Hi, my name is Stacy Wilson. I am the Gastroenterology Nurse Practitioner working with Dr. Serrano here at Good Samaritan Hospital. And this is Good Samaritan Hospital Spotlight, your questions answered. The first question is, do colonoscopies hurt? No. There is no discomfort with a colonoscopy, either during the procedure or after the procedure. During the procedure, you are good and sedated with anesthesia, meaning you shouldn't have any discomfort or feel anything whenever the procedure is complete. Is the prep really the worst part? I would agree that the prep is probably the worst part of having a colonoscopy completed. Procedure day is fairly simple since you will be asleep during the procedure. The ID is probably the hardest part there. But the day before, for the prep, can be difficult because the day before you're not allowed anything substantial to eat. You're only allowed clear liquids, things like jellos, juices, broth. We have allowed coffee and certain sodas. But the evening before the procedure is probably the hardest part because you'll start drinking a solution to help clean out your colon, and then you're more than likely going to be up to the restroom most of the evening. If somebody was eating the day before the procedure and they told anesthesia, their procedure would be canceled. If they tried to lie, anesthesia things could happen, such as aspirating during the procedure if they ate or drank when they weren't supposed to, which is unsafe and can lead to further issues. What happens if they find something? During a colonoscopy, we are looking the entire length of your large intestines for any polyps or growths that might be present. If we see any of those, which are common, we will remove them and then send them to pathology. So if something is found, it will be removed at that time. If the doctor feels that it's something more serious, biopsies will be completed, and then further follow-up will be needed after that. How long does a colonoscopy actually take? Colonoscopies take on average 10 to 15 minutes to be completed. Now, of course, there are some situations if somebody has a lot of polyps that need to be removed or even larger polyps where that time frame is going to increase. But the average patient takes approximately 10 to 15 minutes for the colonoscopy to be completed. What can I eat or drink the day before the procedure? I did touch on this during the first question, but that day before the procedure, you're very limited to clear liquids, and that's not going to include anything red. We don't want it to mimic anything that could be blood related. Whenever you have anything with a red dye, we don't want anything to stain inside your intestines. Dark teas and sodas are also now allowed as well, but of course we encourage as much water as possible to get everything flushed out. Now that will be the entire 24 hours before the procedure, and then normally the morning of the procedure you're not going to be allowed anything to eat or drink until it's complete. Can I go back to work the next day? You absolutely can go back to work the next day. Working the day before the procedure and the day after are acceptable. The only day that is required to take off for the procedure is the day of, and that is because of the anesthetic that you receive. You're unable to drive that day as well, so just no working the 24 hours of your procedure. How often do I really need one? That can change for patient to patient, depending on certain things. The amount of polyps we find, the size of the polyps, a patient's family history will all determine when their next colonoscopy needs to be completed. There are guidelines that are released that we follow as to when we will tell you you will need your next colonoscopy. A patient that doesn't have any polyps and no family history of colon cancer will normally get about 10 years before they're required to come back and have one. Patients with polyps that are small in size may return somewhere between 5 and 7 years, and then with increasing polyps or size, that will decrease the amount of years between colonoscopies. What is the biggest myth about colonoscopies? I believe the biggest myth about colonoscopies is that they can end at a certain age. Now, there are some patients that after the age of 75, if they've never had any polyps and no family history of colon cancer, can stop routine screening colonoscopies. If a patient is having problems, such as bleeding from their bottom, changes in their bowel habits, unexplained weight loss, that would change the circumstances. For any patient that has a family history of colon cancer or has had a history of polyps being removed in the past, we still recommend routine screening colonoscopies. Thank you for joining Good Samaritan Spotlight. I'm Stacy Wilson.